Good afternoon, everyone. Welcome to our Birmingham VA Healthcare System Women Veterans Forum. This is our second forum for the year, and I'm Dr. Kanini Rodney. I'm the Chief of Women's Health Services, and I am delighted to have you join us. So our women veterans that are on the call, thank you for taking the time from your afternoon to join us on this call. And then we also have several congressional officers on the call as well. And so we also welcome you and thank you for joining us. This gives us an opportunity to share information about our women's health programs with you and also information on the VBA. Our VA, our Birmingham VA, values diversity, and the health and well-being of our women veterans is a top priority. Our leadership is committed to providing equitable access and opportunities to gender-informed care and to women-centered spaces and environment. And so this is also evidenced by the fact that our executive leadership are always involved in our programs for our women veterans. And so we have our executive director, Dr. Ladi Kakoyu. I'm not sure if he's on yet, but he will give some words of welcome if he's on. And then our chief of staff, Dr. Andy Sellers. I know he's transitioning from a meeting that I just came from as well, so he may be a few minutes late. So we also want to give him an opportunity to welcome all of you to this Women Veterans Forum as well. I am also going to introduce Amy Southern, who is our Women Veterans Program Manager, and she will be facilitating this session after I give an overview. And then also Tina Green from the Veterans Benefits Administration. If you can go ahead and just next slide, please. All right, so for the agenda for this afternoon, it's going to be a welcome. And as I mentioned, we have our executive leadership on. Then Amy Southern, who is our Women Veterans Program Manager, as well as some of our women's health coordinators are going to give an overview of the services that we have here at the Birmingham VA. And then we have Lisa Green that's going to be talking about the veterans benefits. And then we'll leave some time for you to ask questions and for us to provide some answers to those questions you may have. I understand Dr. Sellers, who is our chief of staff, is now on, and I'm going to give the floor to him so he can give his welcome as well.
Thanks, Kanini. Just checking to make sure y'all can hear me. I'm having some computer issues. Can you give me a thumbs up, Kanini?
Yes, I can hear you.
Okay, perfect.
You're good to go.
Okay. I'm on audio on my phone and video on my computer, so trying to manage two devices at once. So anyway, thanks to everybody for being on the call. I echo what Kanini said. Really great to have what looks like it's going to be a really good turnout for this call, and we look forward to sharing the things that we're doing in women's health and ways we're expanding, and of course reviewing our current offerings, and then also hearing some feedback from all of you. So thanks for being here. I won't take up any more time, but we're glad to have everybody on the call and look forward to listening in.
Thank you. And I think also Dr. Ladi Kakoy is on the call, and he's our director of our hospital, and I'll give him a few minutes to welcome you as well.
Hey, everybody. Let me change. I'm standing so I can be in the camera frame. As Dr. Rodney has said, and Dr. Sellers would like to welcome you all to this Women's Forum, and we're really glad to have everybody show up. I think this is our best attended one in the couple of years we've done this. I see 70 or so people on the line. So we're really excited. We're glad you chose to get your care here at the Birmingham VA. And we want to tell you about some of the things we've been working on and they hear from you. So let me turn it back over to our women's health team and listen to what you'll have to say. Thank you, everybody.
Okay, great. So now I'm going to turn it over to Amy, and she is going to start an overview. Our coordinators are going to give a little bit more detail on some of the things that they're doing, and then we'll move to the VBA and leave some time for a discussion. So Amy, over to you.
Thank you all for joining us. As Dr. Rodney said, I am Amy Southern, the Women Veterans Program Manager, and I will get to our brief overview on women's health. Again, we appreciate you joining us this afternoon. And I think, as you can see, women's health is important to our leadership in taking care of our women veterans. And, you know, our mission is to provide high quality, timely, coordinated care for our services to women veterans in welcoming and safe environments. We know that Birmingham has adopted that, and that's every time we go to make a decision at the table, this is what we keep in mind. Our vision is that we want to be the provider of choice for you. We know that you don't have to always come to us. So for Alabama, we want you to come see us in Birmingham and our other sister facilities as well. Here in Birmingham, we have 2 women's health clinics. One is located in Birmingham. One is located in our Huntsville area as well. We offer a little bit of different services in Birmingham than we do Huntsville, but for sure that you can get primary care at both of these sites in Birmingham and Huntsville, and that's where we just see women veterans only. Now, that does not mean to get care that you have to come just to our women's health clinics in Birmingham and Huntsville. You also can see our designated women's health providers at our outpatient clinics. That's underneath the Birmingham umbrella. We do have a designated women's health provider at all of our outpatient primary care clinics, but then also you don't necessarily have to be on that designated team. When our coordinators speak in a few moments, you're going to know that they're providing that coordination of care for all of our women veterans, not just the ones in a women's health clinic. Y'all are having issues hearing me. Is that
There you go, Amy. There you go. That's what, yeah,
Okay.
there you go. Much better.
I
Much
was
better.
standing up as well, and so I think I was too far away from my laptop.
You sound so much better now. Somebody should be keeping an eye on the chat because people are giving feedback. So thank you. I'll let you keep talking.
All right, thanks. Again, since some of you were struggling, I will do a brief overview of the fact we have a women's health clinics in both Birmingham and Huntsville. You are not required to go to just those clinics. We know that oftentimes you may be closer to our Anniston, Jasper, Gadsden, the other outpatient clinics we have underneath the Birmingham umbrella. That's perfectly fine. We have designated women's health providers for each of those clinics, but they will be seeing men and women both on those panels. But if you are close enough, we would love for you to join us at our women health clinics in Birmingham and Huntsville. Again, what you're going to get at both of those clinics is integrated. We're going to have primary care that you're going to receive, the full range of comprehensive care, looking at chronic disease management. We're going to look at acute care, definitely our screenings and preventative care. Our coordinators are going to go in more detail about that. We have pharmacists on all of our PAC teams that can assist you. And of course, social work is always available. I think one thing that we're really excited about is the fact that we have in-house mammography. I can say not all of our VAs have that. We have it located in Huntsville and also at the Birmingham outpatient clinic. So hopefully you will get your screenings with us. And again, our breast health coordinator is going to talk about those things. I don't want to steal her thunder, but again, know that we can coordinate those appointments when you're coming for other things so we can ensure that you're getting the proper cancer screenings. It's very important to do. For specialty care, we will say in Huntsville right now at the Huntsville Women's Health Clinic, we are just offering the comprehensive primary care there. For Birmingham, we do offer specialty women's health care. We have 2 gynecologists on staff. We have a breast surgeon that's also here. She will see you in the clinic, but then also do procedures. That's the same with our gynecologist. We also have a Mom and More program that's looking at our maternity veterans. Again, our maternity coordinator will speak shortly. We look at urinary incontinence, pelvic floor therapy, working with our PMRS and physical therapy. I think that's a great new service that we've been able to provide. And, you know, when we look at that, even if we can't, we know that our PAC teams are just essential to helping you get all this care coordinated. I know that we talk about all these services Birmingham offers, and I think that's the initial step. Get established with primary care, whether it's in our women's health clinics or one of our other outpatient clinics, and then they can help you navigate the system along with our coordinators. Again, with our women's health coordinators, we have a GYN health coordinator, a breast health coordinator, a maternity health coordinator, heart health, and a women's health mental health coordinator. And these women assist you in if you're getting your care out in the community or with us. It allows us to help coordinate that so your PAC provider is available to see that. And then, of course, give you additional attention for whatever these needs may be that falls under these criteria for the coordinators. And that's a good segue to hand off to them. Again, Madre Jean, our breast health coordinator, many of you have heard from her. We're going to hear from Brittany Sanders. She is our GYN health coordinator. Catherine Smith, heart health. Sherry Dickerson, our maternity care coordinator. Rebecca Smith is our women's health mental health coordinator. And I'm going to hand that off to Madre to talk about what she does for breast health coordination.
Amy, before Marjorie speaks, I just wanted to add, you mentioned about the services, the GYN services in Birmingham. Just want to throw it out there that we are working on getting some GYN services in Huntsville as well. Hopefully this coming year, over the next few months, that we'll be able to at least offer some part-time services with a gynecologist in Huntsville. Now, things may take a little bit of time to roll out, but that is our plan. So we should be able to see that service over the next few months. Go ahead, Madre.
Hi, everyone. I'm Madhuri Jean. I'm the breast health coordinator for our facility. As Amy mentioned earlier, we do provide mammogram services in-house. She mentioned that we have it both in Birmingham and in Huntsville. In Birmingham, the services we offer is pretty comprehensive. We offer screening, diagnostics, we do biopsies, we do contrast mammograms and MRIs, breast MRIs here. And in Huntsville right now, we've started off with doing screening mammograms and hoping to add other services there in the future. So we do provide the service here, and we would like for all of our female veterans to get their breast cancer screening done within our facility. And of course, for patients who live over an hour away from us, community care service is available. So my role is to coordinate the breast cancer screenings for our female veterans, which includes all breast imaging procedures, whether it's done here in our facility or through community care. I especially focus on patients who've had abnormal imaging who need additional workup. So I work with your provider closely to make sure the results get to you in a timely manner, and the next steps are ordered and you get scheduled in a timely manner, especially if you are going out into community. There can be some gap in information that you're receiving. So I'm your point of contact, a person that you could call to help you facilitate that process. I also provide breast health and cancer screening awareness and education for our female veterans. We do fairs and go out to outreach events to provide this education. And then also I work with our PAC teams here within the facility in educating our staff on how we can order the breast cancer screening and completing the reminders. And again, mainly all my focus is on breast cancer screening, so I collaborate with many disciplines here within our facility, our radiology team, community care team, your primary care team, and making sure that your care is smooth and everything is done in a timely manner.
Thank you, Madre. Brittany, would you like to speak on GYN health coordination?
Yes. Hello, everyone. My name is Brittany Sanders. I am the GYN health coordinator for the Birmingham VA healthcare system. There are several things that I do related to gynecologic health. One thing is that I may contact you if you're due for a pap smear. I may perform that pap smear or work with your primary care provider to ensure that it's happened or that you've been scheduled. If you were seen out in the community and that pap smear was done, then I can work to try to obtain those records if we referred you out or if you went out on your own. I also work with the primary care providers, whether they are designated women's health providers in our CBOX, the providers here in the women's health clinics, and even the providers who are not designated, to ensure that they're comfortable doing different exams like your pap smears. I also help organize and order STI testing or STD testing. So if you were to have a positive test or if you ever wanted to have screening, we can make sure that's done. And I also will help with treatment. I have a log, and I'll track people who have had pap smears to ensure that if they have any abnormal results, that they have the follow-up that they need, whether that's done here in the Birmingham VA with our gynecologist, or if they're seen in the community based on preference or distance. And I also work with veterans to provide counseling about contraception, as well as menopause and STIs or pap smears. And then my contact information is here on the bottom of the slide.
Thank you, Brittany. For our maternity care coordination, Ms. Sherry, are you ready?
I am. Hello, I'm Sherry Dickerson, and I'm the maternity care coordinator. So anytime you have a positive pregnancy test, it comes to me. If you are out in the CBOX, it also will come to me. We don't just do the ones in Huntsville and the ones in Birmingham, so everyone gets the same. And they will come to me, and I will help you get those consults put in for your OB provider so that you can have timely care out in the community. We do not have obstetrics here in the VA, so we do send all of that out. I also will, whenever you go to the doctor, if you need consults for any specialties, maternity fetal medicine, any kind of consults like that, I help put those in. If you need anything else, I work closely with mental health and with pharmacy. We also work with the PAC teams and the primary care provider teams so that we can make sure that you're getting covered in every area that you need to be covered and that it's timely to be covered in that. We will follow you for the first year and call you about every once trimester. And if you need to talk to more often, absolutely talk to you more often. We're going to monitor things like blood pressure, diabetes, and postpartum depression, those things. We're going to monitor those and call you more often. Then after you have the baby, we're going to follow you for as long as you're breastfeeding. Actually, we follow you at least a year, but as long as you're breastfeeding, we're going to keep up and follow you and help you, assist you get anything that you need with that and any help that you may need to further your pregnancy or to help with whenever postnatal.
Thank you, Sherry. And I think with our Mom and More program, a lot of you have heard about that. Where Dr. Rodney is the physician for that Mom and More clinic. We do a shared medical appointment that is with several disciplines that include our pharmacist, our social worker, our intimate partner violence coordinator, different things in our community partners. This opportunity, I know some of you have joined us. Thank you for the donations that we're able to give a baby shower / shared medical appointment that I think is always exciting for our veterans and an opportunity for us to assist you. So we look forward to having those in the this next coming year as well. So hopefully we'll see our maternity veterans soon at the next event. Thank you, Sherry. And we're going to hand off to Miss Kathy Smith. She's going to join us. She is our heart health coordinator.
Hello, everybody. My name is Kathy Smith, and I am the heart health coordinator here at the Birmingham VA. In my role, what I try to do is identify women who are at high risk for heart disease. Typically, these women have other conditions such as high blood pressure, diabetes, high cholesterol, and I just try to coordinate that care, make sure that those female veterans are up to date on their A1C, their blood sugar labs, on their lipids, their high cholesterol labs, and just make sure that they're also up to date with their primary care appointments. So I could be calling and saying, hey, you might be a little overdue for a primary care appointment. Can I help you get scheduled? I also do a lot of care coordination. Want to make sure that I offer these female veterans some risk reducing strategies, some ways and education that they can reduce those risk factors. We collaborate with, of course, primary care. We do some nurses, social work. I work closely with nutrition and even whole health. They, with Tai Chi and even yoga, sometimes that helps to reduce stress, which can reduce our risk factors for heart disease. We also do some education on, in February, that's our big heart health month. We go red for our ladies in February, and typically we have a chit chat that is online, and it's typically on Facebook, and it's just some education, some resources. We collaborate with different disciplines and just give all the information that we can to our female veterans. And then we always have an accompanying heart health fair in the lobby at the annex. The same principle applies where we have different disciplines come and different education. So it's really a fun time for us at the Women's Health Program. We also have a program, which is, we call it DPP, but it is our virtual diabetes prevention program. And what it does is it assists our female veterans in ways to help prevent diabetes and obesity. It is a completely free program for our female veterans. So if you qualify, you can join, and it is a year-long program. We've been doing it for about 2 years, and the feedback that I've gotten from female veterans has been really positive. What it is it's online, like I said, so you can schedule your educational sessions at your convenience. It offers it's CDC approved curriculum. You get a trained coach, you get group sessions. It helps you learn how to eat healthy, how to manage your stress. It also helps you learn how to just add more activity into your daily life. You also get access to a portal or an app. And in that portal or app, it gives you information on healthy recipes, how to meal plan, of course, to be more active. It helps you track your progress. And female veterans will get a free smart scale that they can connect to their device. And of course, that's a way that they can track their progress in real time. So that's just something I really want to let you guys know about. My contact information is underneath there. I'm at extension 332912. Thank you.
Thank you, Kathy. And Kathy is your point of contact if you're interested in DPP and other heart health things. But again, that has been a very popular and positive program that they're having, and she will help you get enrolled in that if you are interested. So please contact her for that. Miss Rebecca Smith, are you ready? She's our new Women's Health Mental Health Coordinator.
Hi, everyone. I'm Rebecca Smith. I'm your Women's Health Mental Health Coordinator. As Amy said, I'm a licensed clinical social worker. I am a new addition to the Women's Health team, but I am not new to the field. I come to you bringing almost 20 years of social work and mental health experience. So I, right now, I'm working alongside your maternity care coordinator to assess for mental health needs and provide psychosocial support for our maternity veterans. In the future, I will be expanding my services to provide support for all phases of life and for different health conditions, including maybe positive cancer screenings or other life stressors.
Thank you, Miss Rebecca.
Thank you.
And again, we have a lot of mental health resources available to you. We have our Intimate Partner Violence Assistant Program available. We have 2 IPV coordinators, Miss Amanda Phillips and then also Miss Tammy Moore. She's located at the Huntsville Outpatient Clinic, and then she does the Northern clinics, and Amanda does the other clinics that fall under the Birmingham umbrella. And we just want to remind everyone about our crisis line that is available. September is Suicide Prevention Month. And, you know, it is so important that you know that you can dial 988 at any time to reach the crisis line, and then you're going to press 1. So we just always like to share that anytime that we are doing a presentation, that you know that that is available. Also, some other resources that we have, the Women Veterans Call Center. You're going to see that number advertised a lot with related to materials from Women's Health Services nationally. That's just due to, if you call that number, they have a list of all the WVPMs, which that's me for Birmingham, and whatever area, whatever's your closest location, they will send that to me. We have 3 days to act on your referral. When you call the call center, you can call them about, a range of things, but again, they're going to put you in contact with the correct person, and then we'll receive a notification by email for that. We also have a psychiatric intake response center that's available that is for adolescents and children that you can use, and it's a resource that our veterans, they can use for their families. And of course, we always want to share a domestic violence hotline. That number is there as well, and we can put these in the chat as well, so everyone will get access to those if you need it. I know we've had several questions in the chat box, and so what I'm going to do, I am going to go ahead. We're going to take questions at the end for our session, and I'm going to go ahead and let VBA go ahead and go, Ms. Tina Green, and that way we will address all the questions. You can put them in the chat box, and then of course we will start answering them in the chat box, and or we will do them verbally as we wrap up at the end.
Amy, I am also answering in the chat box, so
Yes.
most of these have been answered, but I'll continue to monitor.
Great, thank you, Dr. Rodney. So for our benefits overview is Ms. Tina Green. She is from our Veterans Benefit Administration. Tina, are you with us?
Hi, this is Wendy Cosby with VBA. Tina was not able to make it, and she asked me to fill in for her.
Well, thank you, Ms. Wendy. I know you've joined us before on a forum, so thank you for stepping up and covering for us. We appreciate that.
My pleasure. Anything I can do.
Okay, well, I will just let me know as you need me to advance the slides, okay?
Okay, so my name is Wendy Cosby. I work with Ms. Green at the Montgomery VA Regional Office. And so we're just going to kind of give a summary of some of the services that VBA offers. We do have quite a variety of services that we offer to veterans, their families, and survivors. These include things like compensation, which is service connecting disabilities to your military service. We offer pension services. Pension services is an income related service. That's, you can file for pension and they'll take your information, you fill out the application, they take all the information and figure out if you qualify or not. Fiduciary services for veterans who are unable to manage their own finances. We can review that and appoint a fiduciary for them. We offer insurance services. There's quite a few different types of insurance available. We have education services, home loan guarantee program, and the Veteran Readiness and Employment Program. All of these are just really great programs that work together to provide a lot of extra great services for our veterans. Compensation and pension are both tax-free benefits. Compensation's based on your service-connected disabilities, and pension is income-based. Fiduciary services, as I said just a moment ago, are for veterans or their dependents who are not able to successfully manage their VA funds. Insurance services, one of the ones that you may be most familiar with is once you're service connected for a VA disability, you'll get with your letter there's a little paragraph in there that explains about the insurance available through VA, what that covers. It recently changed. I think it was in January of last year that changed to a new program that's actually supposed to be a lot better. I believe it offers higher benefits, lower rates. So if you haven't looked into that, definitely look into that. Education services are available to qualified veterans. This can be things like your 9/11, your GI Bill, those kind of different things. Go ahead and go to the next slide, please. Home loan guarantee program. Now this program is a reusable benefit. This helps veterans who can get a home, or if you already own a home, you may be able to refinance through the home loan guarantee program. A lot of different benefits available through that. VRNE assists veterans with services that can help them gain meaningful employment to better care for themselves and for their families. And it can also help people who are unemployable so that they can maintain a more independent lifestyle. So that could be things like if a veteran has a hard time getting in and out of their chair, they may be able to help with like a lift chair. There are other things that you can do as far as like widening the doorways and things like that, but that goes through a different part of VBA. But VRNE can assist with those kind of things. Also, like I want to say, like if you need certain utensils or certain types of maybe like a specific type of coffee pot, or things like that, just to help you function better and not need quite as much help with your daily activities. Those are all kinds of things like that VRNE or some of the other programs through VBA might be able to assist with. Next slide, please. Character of discharge. This is one I always like to talk about whenever I'm talking to veterans. I know for a long time, you'll hear people, oh, well, if you have an other than honorable, you can't get any VA benefits. That is not 100% true. I always advise veterans, even if you have an other than honorable character of discharge, please go ahead and apply anyway. VBA will do what we call a character of discharge determination, and we'll look at all your records. We'll look at the reasons for the discharge. We look at the facts and circumstances surrounding the discharge. And they have actually just recently updated the character of discharge process. And so we're actually reviewing a lot of character of discharge decisions that were made before that under the new guidance, the veterans may now qualify for assistance, whereas they didn't before. You can, with an other than honorable discharge, you can still receive healthcare benefits. You may receive healthcare and compensation payments. You might not receive either one. So I say just submit your application and let the VA sort it out, because they're the ones that know how to do all the different types of determination and where to get the records and all of that sort of thing. So if you or somebody that you know has that type of discharge, please advise them that they can go ahead and file and let us determine what the character of discharge is for VA purposes and whether they would qualify for any type of VA benefits. All right. We also have the National Call Center. The National Call Center is a phone number. It's available Monday through Friday from 8 a.m. to 9 p.m. Eastern Time. That phone number is 1-800-827-1000. And these folks can provide you answers for a multitude of questions. They have at least a little bit of knowledge about most anything that VBA does. If they don't know the answer, they usually know where to get the answer or where to have you go to get the answer. So any questions that you have, if you need to talk to somebody right away and your local VA office is closed or you can't get a hold of somebody, feel free to call that 1-800-827-1000 number, okay? Next slide, please. All right, we also have a program called VERA. This is a website. You can Google VAVERA. And if you do that, I think it's usually the first one that pops up. It's a VA VERA app. That's the Veteran Engagement Reporting Application. And you can schedule an appointment with a public contact representative on that site. We usually have the little QR code. You can see it on the screen if you're on the call, or there may be some at the VA hospital posted around in places. I'm not 100% sure. If not, if y'all would like those, let me know and we'll get you some of those. But you can go in there and you can schedule an appointment with one of our public contact reps at the regional office in Montgomery. You go in there, you give them your information, you tell them what kind of questions you have, and you select the day and you select the time from what's available. And at the day and time that you select, if you choose in person, you'll come into the regional office and you'll sit face to face with somebody. But if you choose virtual, then at the day and time you select, then our representative is going to call you on your phone. There's no special equipment needed. It's just a phone call, and you'll be able to talk to them one-on-one. They can pull up your file and look at it. They can tell you what's needed, what you might need to do, and give you that kind of advice. So really, really, really great tool there. All right. All right, so also very, very important for any of our veterans or anybody who's in crisis, 988 is the crisis line. And if you press 1, it gets you to a representative who is specifically trained for veteran issues. Now, if you're not a veteran, if you know somebody and they're not a veteran, you can still dial 988. It's the national crisis line. Anybody in crisis can call this number. You can also send a text to 988. Sometimes if you're in a deep crisis, you may not feel like vocalizing, so you can text. and they'll text you back. Sometimes people are more comfortable with that. So you've got a couple of options. You can also go to the website. They have a chat option on the website that you can use. So there's several different ways that you can access that assistance if you need crisis help. All right. Any questions about the VBA stuff? I see there's a couple in the chat.
Yes, we have a couple. One wanted to know more. I'm trying to about veteran loans assistance.
So the VA, the home loan program, basically what that does, the VA is not actually loaning the money. What the VA is doing is backing your loan. So you would still have to get that loan through like your bank or your credit union or somewhere like that. And then the VA would do the backing of it. So it's almost like a co-signer, but not quite. So that's something, honestly, that if you have questions about the home loan program, I will see before the end of the call if I can get the information, the phone number. There's another phone number you can call where they are more specifically trained on the home loan program. And I'll see if I can get that phone number for you before the call ends. And are y'all sending out like an email to the folks that are participating on the call?
We are not, but we can put it, our public affairs is going to place this recording on Facebook, our Birmingham VA Medical Center Facebook page. And so we can include that content in this presentation and then I'll place it there.
Okay. All right. So if I'm not able to get it before the call ends, then you can look for it on their Facebook post. And I'll try and get that home loan phone number for you so that way they'll give you a little bit better and more in-depth information because I don't want to steer anybody wrong on that.
Are we able to get the slides?
Yes, we will send those to public affairs and we will have them put those on Facebook with a recording as well. And so we can add that, Wendy, if you'll email me, we can add that. And also Miss Denise wanted to know, could you go in more depth about compensation and pension and that process?
Sure. So compensation is if a veteran has a disability that is a result of their service. So it's not always that something happened to you while you were in service. Sometimes you have a condition before you go in, and because of your service, that condition worsened beyond its normal progression. We call that aggravation. There are times where we have things you guys have probably all heard about, Agent Orange, the herbicides, and the different things that come about years down the road from being exposed to herbicides, the burn pits, those types of things. Those are what we call presumptive conditions. Sometimes when you're exposed to certain chemicals or things like that, there may be things that you come down with later on down the road that don't show up right away. So typically there's three things that we have to be able to service connect. One of those is an event in service, which would either be treatment or an injury or something like that, or exposure to one of these chemicals or something that you've been exposed to. So an event or injuries that was in service or caused by service. Current treatment or symptomology, which means you're currently now, let's say if you dislocated your ankle during a march in boot camp and it got better and they let you graduate and you went on, but you kept having problems with that ankle and you're still having issues with that ankle. So you had an event in service where you dislocated your ankle, you're still having problems with that ankle. Those are the event in service, current treatment, or symptomology. It's not always necessary to have the treatment if you can describe your symptoms. So if you file a claim and you haven't been getting treatment because maybe you didn't have healthcare coverage, you can still submit a statement saying, here's the issues that I'm having. I've been having them since this incident in boot camp or in service. And then what we do is we request an exam if it's warranted. And then that exam gives us that third part, which is the nexus. So in other words, the event that happened in service and the issue that you're currently dealing with are connected. So those are the three things: your in-service event, your current treatment or symptomology, and then that nexus that pulls those two things together. So once we have that, then that's when it goes to the rating team, and the rating team determines based on the regulations, because they have a list of regulations that they have to go by. So based on those regulations, they're going to make the determination, is this service connected? And if it is, at what %? And so they just look through the regulations, and the regulation says if they've got this, this, and this, then it's going to be this percent. If it's that, that, and that, it's that percent. So that's how they determine on the compensation. For pension, you have to have served at least 1 day during wartime. There's a different form for that, and it's going to ask about your income and your outflow and different things like that. We don't work pension claims here in Montgomery. Those are only worked by certain ROs. But what they'll do is they'll take your application. If they need more information, they'll send you a letter, and you send that information back. And once they get it, they're going to figure all of that out and determine whether or not you qualify for pension. Pension is, it's not a lot of money. Pension is probably not what you want to go for unless you absolutely have to. Basically, what pension is going to do is it's going to bring you up to around the poverty line. So if you're getting $800 a month, and let's say, and I'm not sure exactly what poverty is right now, I'm not 100% sure what the full pension grant would be, but let's say if that line is at $1,200 and you're getting $800 a month from Social Security, then the pension program would pick up that $400 to get you from the $800 to the $1,200. So whatever you're, like, if you're getting Social Security for a disability, but it doesn't have you up to that line, then the pension program would bring you up to that. It's a great program if you need it. Compensation, if you can get it, is a better benefit, but pension is there if you need it, and it's not a bad benefit. It's actually, you know, it can be very helpful. So did that explain kind of what those two are?
Yes, she said, thank you. Is there a minimum age for a pension?
No.
Question.
No, there's not. Okay. I see one about the compensation being stuck since June. So that would be something like that. That's kind of a more of a one-on-one thing. What I would advise for that would be to call that 1-800 number, or if there's a way, I don't know, somebody at the Birmingham, I don't want you to put your information in the chat, but if there's somebody there at Birmingham that can get her contact information and maybe email it to me or something, we can take a look at that and give you a call back.
Yes, if you will call me directly, I will call you back, and then I will get the information to Ms. Cosby.
Were there any? I see a lot of new messages. I'm not sure what, what the questions are.
I see a hand raised. Ms. White, would you like to go? Ask your question.
Yes, hello. My name is Reginald White.
Oh, I'm so sorry. I apologize.
No, that's quite all right. Reggie, Regina, it's both the same person. No, it's just me. But I had a question in reference to, because I was in the Saudi and I did the burn pit registry, but I'm not exactly sure what else to go from there. And so I didn't know what else to do from that. And then number two is for retraining, because I started a job as a contractor, and it's some of the things are just, you know, more kept getting piled on. So getting retrained, going back for things like a PMP certification or retraining to another different career in order to keep pace with some of the younger people or with the industry that I'm in, which is aerospace engineering, and also thought about business, you know, business ownership, entrepreneurship. Want to get some information on that, either getting retraining, certifications to better maintain employment or advance employment.
Okay.
Over.
All right, so for the burn pit registry, basically what the burn pit registry is they're getting information from you, and they're using that to kind of figure out, okay, do we have an abundance of veterans now who are suffering from this illness that were exposed to such and such. So that's kind of what the registry is. Now, where you go with that is if you have an illness that comes up, like let's say you don't have it right now, but in a year you have an illness that's related possibly to that burn pit exposure, then at that time you're going to file a claim for that disability. Okay, and then we would look at that as based on your exposure. So that would be one of those presumptive conditions. Now, not all conditions have to be listed in the presumptive conditions, because it tells you in there that that's not an exclusive list, that there are other conditions you may be able to qualify for. One of the things that I recommend for folks to do is you can submit a credible resource. Like if there's a study by Johns Hopkins that shows that the disability you have is related to an exposure of something that you were exposed to. If you can find credible resources that link those things, you can submit that documentation. Just make sure it's a credible source. You know, we don't want Wikipedia or the National Enquirer or things like that. It needs to be a credible source. So if there's something like that where you feel like it was because of a certain exposure, but there's not, the VA hasn't linked those things yet, research that, Google it, and if you can find those credible resources, submit that with it as well. So the burn pit, those kind of exposures, it's not, you don't get a rating just because you were exposed to the burn pits, but if you develop a disability as a result of that exposure. Does that make sense?
Yes, yes.
Okay.
I know it. I had been overseas a few times in the same area and never had any issues, but the third time is a charm, and I ended up having allergies, developing some allergies, which I've never had my whole life.
Right.
Allergies, and also some breakouts due to
Okay.
I guess the environment over there, because it's not a really conducive environment.
With that, again, like if you would like to provide your information to Miss Southern, and she can get that, your contact information to us, we'll have somebody reach out to you and get with you one-on-one and kind of go through and look at what's in there and see if there's something that you can do right now. And then as far as the retraining, if you're in the VRNE program, talk with your VRNE counselor. If you're not in the program, I would recommend applying again, and just fill out like a statement as to why you feel like you need additional training or those kind of things, like what you were talking about, to try to keep up in the industry, that you need this additional training, and see what they can do. I'm not an expert on VRNE, but that would be my suggestion, is to put in a new application and just explain to them why you're requesting this additional VRNE assistance.
And yes, we will get with you. This is being recorded, so we are asking you not to do specific medical issues with your questions. And so if you will contact me by my phone number, we will get you your information to Wendy so she can, you know, drill down to the issue. I know we have a lot of questions. Stephen in Public Affairs has been monitoring the chat, and I think he has some more questions for some of us. Stephen?
Good afternoon, everyone. I'm just going back from the top. One of the first ones we had was someone asked about holistic care. They just want to know if we had any physicians that offered functional holistic care.
Oh, okay. That's, I was about to say, Dr. Rodney may want to answer this. I know that we have a robust whole health program, and, you know, I'm not going to classify any of our physicians as functional medicine. I see what you're saying, but we do have whole health that is offering different types of services. I know we talked about the Tai Chi, the yoga. I know that we have a chiropractor, different things like that. So what we can do, if you will reach out to me, I will see exactly what you're looking for, and then see if we have something that will work best for you. But at this time, as far as I know, we do not have any functional medicine doctors on staff.
Okay. Also, we have a question about how do I start primary care?
What you can do, I know Dr. Ronnie put Madeline Williams, her contact information in the chat box. You can contact her or myself, and Madeline will get you scheduled with a primary care provider. She will talk to you, see where you are, the clinic you're located closest to, and what your preference is, and then she will work to get you scheduled, whether it's within women's health or outside, but we can help facilitate that.
Let's see. And SF would like to discuss the pact with someone. Reach out and we'll get you that information.
Yes, we can get you connected to a PAC team. A PAC team, for those that may be new to the VA, is what we call our primary care teams. It includes a physician, an RN, an LPN, and also a administrative support person that will be assigned to you as a team to provide your care. So you know who those contact people are as you are, you know, getting scheduled and coming into the clinic. That will be your team. And so we call it a PAC team.
And I have a couple of questions about encountering homeless female veterans. Who should they direct them towards?
We have a homeless program and a homeless coordinator. I will get that contact information and drop it in the chat. Or if you will call me, I will email her your contact information directly so she can speak with you.
It looks like the link for the homeless veteran care at Birmingham has been put into the chat along with it.
Great. Well, I had reached out to my, I know they're reading the chat box, so they're trying to answer. So great job that someone has dropped it in there for you. Thank you, Ms. Benita, for looking out for our fellow homeless veterans. I know they're going to appreciate you trying to connect them to services. Okay, did we get all the questions? I know Stephen is going back through to make sure. Do y'all have any additional questions? We have a couple of minutes.
I have a question.
Okay, go ahead, Ms. Norman.
Okay, I have two actually. One was I'm with Bessemer. I live in Helena, and I was going to the VA downtown for years and years, and then with the travel pay or whatever, they said I should be going to Bessemer. And I didn't even know anything about Bessemer, but now I've been going, and I do not like Bessemer. How can I change and go back to the one downtown? Because this one in Bessemer is convenient, but I don't like the doctor.
Well, I apologize. It's not been a positive experience at that clinic. What you can do, Madeline, if you will, you can call me or Madeline will get you scheduled back in Birmingham. But I will say they will only pay you travel pay to the closest clinic. You can come to us. It's just you're not going to get, you know, the travel will stop at Bessemer versus coming here. But yes, we are more than happy to take you in the Women's Health Clinic. So what you can do, reach out to me or we can, or Madeline, and Madeline will get you scheduled.
And okay, Madeline, I've put Madeline's contact information in the chat. She's probably the best person to contact because she can actually schedule you. If you contact Ms. Southern, she's just going to need to contact Madeline in order to get you scheduled. So contact Madeline and she can help you and take care of you.
Okay, and then I have another well, it might be, I don't know. Anyway, it's about the jobs. I put in for several jobs. I'm with VRE right now, and I'm a class and a half away from having my bachelor's degree. And I put in so many applications with USA Jobs over the years. And it's like they never call. And I've checked on a couple of them, went to where I went, and they hire people who are not even vets. I mean, I thought we got first priority. You know, basically, and I had the experience. I had the experience. I had everything, but the person who, two people I know who they hired were not vets. So does anyone check on that, or is anyone over that, you know, to monitor it, to see, to make sure that we're getting what we should, you know, be getting, or in the position where we should be?
This is Wendy Cosby. I just kind of wanted to chime in real quick on this one, if that's all right. I would suggest maybe reaching out to your regional office and looking at VRE, see if you can talk to somebody with VRE. With USA Jobs, their application process is pretty specific what they're looking for. So I feel like VRE would probably be able to help you get your resume built, and because like for each job they have different things that they're looking for and your resume needs to reflect that.
It does.
Yeah, the process that they go through, it's kind of particular on what they're looking for. So I would suggest reaching out to your local regional office, Montgomery. You could probably schedule a Vera appointment or just call and try to get a hold of somebody with VRNE. Again, if you'll send your information to Miss Southern, reach out to her and get your information to us, and I can try and get that forwarded to VRNE to have somebody with them maybe call you back and let you know kind of what resources.
Okay.
And congratulations on getting your degree. You're so close. So congratulations. I know you've worked really hard.
I
So
have.
yes,
Thank
and
you.
I will say the process does take a while going through USA jobs.
And I've been doing it for years. I mean, I retired from the post office, and I've been putting applications in even before I left the post office, and I've never gotten. Nowadays, they're saying they send me an email saying that they received my application. Then the next email I get, it'll be like, we received your application, but you put it in after the deadline, which you can't even do it after the deadline. You can't even go all the way through.
Go ahead and, like Miss Wendy said, send me your information and we will see. And with USA job postings, typically you were going to see a contact person on those job announcements. And I would encourage you to reach out to make sure everything is submitted. Hopefully you can get them.
You can't.
When you call, I know that they do have them on those job postings.
Yeah, if they don't answer, 5 times out of 10, you may get somebody. But all right, well, thank you guys. Thank you so much.
Miss Wendy, I think this is another question for you real quick. I know we're at the last question. Dishonorable vets, who should they be referred to?
What I would suggest for that, there's a couple different routes. So you could assign a POA. A POA is one of the veteran service organizations like Wounded Warrior Project or VFW or the Alabama Department of Veteran Affairs. There's a form that you can fill out. You can take it. Alabama Department of Veteran Affairs has an office in every single county in the state. And if you Google Alabama Department of Veteran Affairs and it takes you to their website, if you scroll, I think it's like just a couple of bullets down, it says find your local office, and it'll bring up a map of Alabama and you can select whatever county you're in and it'll give you that information. But you can select, if you look at VA form 21-22, it will have a list attached of a bunch of different VSOs, a bunch of different organizations, and you can choose whatever organization you want. If you're affiliated with one, if there's one that's closer to you, you can choose that. You fill out that form, you sign it, that POA would sign it. POA is the power of attorney. That's the same thing as the VSO. They would sign it, they would send it to us, and then that grants them access to your file, and they'll be able to see everything that we can see. And they can help you and answer questions and things like that. With the COD, it's really just going to be a matter of filling out your application and sending it in. And then once we receive that and we see that there's a DD-214 with an other than honorable discharge, we're going to start that COD process. So there's really nothing for the veteran to do unless they want to submit a statement. If you got a discharge and you want to submit a statement as to why that discharge happened, that there were circumstances surrounding that. Sometimes, you'll have a veteran who they served 16 years. They were excellent. They were getting, awards and just amazing service. And then they get deployed and they come back and all of a sudden they're drinking and they're fighting and they're getting in trouble. Obviously there's something that triggered those behaviors. So we can look at that and we can say, okay, well, they were deployed, they saw combat, these issues, maybe they had a traumatic brain injury. We take all of that stuff into consideration. So really the only thing for you to do would be to file your application. And if you want to submit a statement as to what happened around that discharge, you could submit that too. And you can go through a VSO and they might be able to help you out with it, even, wording the statement and things like that.
Could you say again where you would get that application for the dishonorable discharge? I need to refer it to someone.
Sure. If you've never filed a claim with the VA before, you're going to file on the VA form 21-526EZ. And if you Google that form, it should bring it right up. You can just print that form out and fill it in, or some of them will let you fill it in online and you can print it out already filled in. And then you just sign that and you mail it in. Or you
So
can
that's
upload through,
VA 21526-EZ.
Yes, ma'am.
Okay. And then have them contact the Veteran Affairs in their area
Yes,
after they submit the form or before they submit the form?
They can contact, they can use Vera. They can use Vera to call, to make that appointment so that they can talk one-on-one with one of our public contact representatives. They can also call the 1-800 number that we shared earlier, that 1-800-827-1000. They can call that number. Either one of those, they can actually send them the forms if they're not, maybe not technologically savvy. Some of us are not as savvy with all that stuff. So
okay. All right. Okay.
those are also options.
Thank you.
Yes, ma'am.
And there are a couple other questions in there about the homeless coordinator. There's a contact posted in the chat for you. So if you just scroll in the chat, you'll see that. And then there's a repeat question on military sexual trauma. That information was also answered. We do have a coordinator, Dr. Susan Isbell, but all of our mental health providers can provide that care, but that's also in the chat. I think those were some repeats. So just wanted to bring people's attention, just maybe scroll back and you can copy that information from there. All the contact information, extension numbers, et cetera, for all of the people that we talked about today: Amy Southern, Madeline Williams, our homeless coordinator, MSD coordinator. And then, of course, if you have any other questions, you can always reach out to us. Amy Southern is our main contact, and then she can help to triage your questions and get you to the right person to answer your questions, whether that is the Birmingham VA or whether it's the VBA. It's after the hour, and so we want to be very respectful of your time and the time of our other guests as well. So thank you very much for this really engaging session. We really look forward to hearing, well, first of all, for sharing information about what we do, and then hearing from you, because it does give us an idea of your knowledge base about our services, and then also if there are gaps in our services and things that we need to work on in the future to make your care more comprehensive. So thank you again, everyone, for joining us. Have a pleasant evening, and hopefully we'll see you at the next Women Veterans Health Forum. Thank you and good night.